Welcome to In Session by Westside Children's Therapy, the podcast about the real work of pediatric therapy and the tools that help kids find their voice. Whether you're a parent, caregiver, therapist, this is the space where real conversations happen. Each week we sit in session with experts in the field to talk about the work, the wins, the challenges, and the science behind helping kids meet their full potential. I'm your host, Marika Cackett, and I'm so glad you're here. Let's get started. We're in session. Welcome to In Session, Growing with Therapy. Today we are joined with Allie and McKenna, an OT and counselor at Westside Children's Therapy. What is OT? What is counseling? How do they work together? What we like to think of at Westside is OT fuels the body, counseling fuels the mind. So buckle up, we are in session. Hello, thank you guys for joining us today.
Yeah, thanks for having us.
Absolutely.
So one of the most common questions when we talked about this podcast, parents were like, what is OT? And is it counseling? Is it one or the other? Like, what is it?
That's funny that you asked that question. And I'm not shocked that you start with it either. We're kind of known as the jack of all trades in OT. That's one thing I would say is a common consensus among all of us. We dabble in a little bit of everything. So we're looking at anything that is keeping you from accessing the things that you want and need to do from your daily life. We will figure out ways to address that, whether it's through accommodation, whether it's through skill acquisition. We want to help you be as independent as you possibly can be and have that overall well-being in your life.
I love that. And I think, a lot of times the fields really do complement each other, whereas OT kind of more focuses on being good to go in your body, and counseling, it's like, I'm good to go in my mind. So when you all are working with kiddos, do you find that a lot of kids in OT also benefit from counseling?
Definitely. I think we share a lot of similar philosophies, a lot of similar approaches, especially when we're supporting children who experience challenges with emotion dysregulation. But I think anxiety as well, and how that presents in the mind and in the body, in trauma, so many different components at play that both OT and counseling can really support.
And I think for a parent, let's kind of talk specifics. What are some specific challenges? I mean, in other episodes, we've talked specifically about counseling needs and whether or not you have to have a typical, diagnosis. But what are some situations where a parent would want to seek both OT and counseling for their child?
It's a great question. I mean, I think going back to what McKenna said a little bit and what you were saying too, is that we complement each other so nicely. I think we both target things in very similar ways and have very similar approaches, but I think we're looking at occasionally different whys behind what we're seeing. In OT, we're taking more of that bottom-up approach, that neurophysiological. Is there something, specifically the sensory system, that is impeding your ability to execute the skills that you might otherwise have? I think that's something that's a little bit different. We're looking at arousal levels. We're looking at how are you functioning in your daily life at baseline? And how does that compare to developmental norms? All of those pieces. And I think that works very nicely in conjunction with counseling, because we're able to provide some of those neurophysiological feedback pieces and give sensory strategies and accommodations that can help these kiddos access their world a little bit easier and a little bit more comfortably throughout their day. So then they can step into their counseling session and really have their body ready to process through those feelings.
Absolutely.
I love that. So I think for a parent, how can you help them understand from a functional point, and then also understanding needing the functional help versus needing the emotional help, and how they sort of tie in?
I love the word function, and I think that's a lot of what how OT and counseling very much parallel and come together, because just as she had said, looking at the neurophysiological components and how we can best support the child and their ability to function in a daily life, and we can look at some more of those psychological components and how we can support them with functioning as well. And so I think it's challenging, I think, to answer the question of, is it either OT or counseling, or is it both? And so I think a lot of that comes, what we do is we typically screen the child to see, is there, an emotional component, a deeper emotional component that counseling can support and can highlight. And then is there that neurophysiological component that OT can highlight? And so it's really the best thing you can do is ask and consult with an OT or a counselor to see how we can best support them.
So let's dive a little deeper in OT specifically. When you hear these words like my kid's a sensory seeker, or he has sensory processing disorder. Does that mean he has autism? Like what is it? So there's all these kind of like things with the social media being thrown around. So like let's just break it down bare bones. What is OT?
So OT,
occupational therapy.
Occupational therapy. Yeah, girl, thank you. Going back to what I think I opened with earlier today, we are here to help you with anything that is impeding you from accessing your daily life. Your question is kind of multifaceted, so I'll kind of go back to the autism piece to start. We do see correlations with sensory processing and ASD in particular at high rates of incidences, but correlation does not equal causation in this instance. You can have sensory processing challenges and not have autism. You can have autism and not have sensory processing challenges. There are neurotypical kiddos, who have a lot of sensory processing challenges, and it's just dependent on the individual. We all have sensory preferences, and I think that's my biggest takeaway for people is that you might not realize that you have sensory processing differences because throughout your life you've learned how to accommodate for it. So as I'm sitting here shaking my foot, that's a sensory.
Oh, really?
strategy.
That is?
Yeah.
Oh, okay.
So giving myself a little movement input to kind of regulate my system while I sit here. Yeah, that's a sensory strategy, and it's things that we do in our daily life that we don't even realize we're doing to regulate ourselves because they've just become second nature to us. My husband hates the sound of people chewing, and I know that's a trigger for a lot of people. But that's a sensory preference, and when he says that, he's like, I just get irrationally angry. And I'm like, because your system can't handle it. Your thresholds are not high enough to be able to tolerate that much input in your daily life, I could do, oh my gosh, a whole segment on sensory processing because that is like my passion.
Well, so let's talk a little more too about sensory processing. Yeah. So for someone that, for example, like who's nervous, that might have what they call like a nervous tic or something. Mm-hmm. When does having that nervous tic become a problem to when you need OT to intervene?
I'm going to bring it back to that word function. And I would say when it impedes your ability to function in your daily life, that is when we get more so involved with OT. Like I said, everybody has sensory preferences. Everybody has, coping skills and accommodations that they use to get through their day. It's more so how much does that impact your ability to get through your day?
Yeah. And how can you help a parent, or what advice would you give a parent who's just sort of embarking on this journey and they might need OT or they might need counseling? I mean, how can you help them balance both?
It's a great question. I think really empowering them to understand the why behind what we do and how this can be beneficial for the child and how this can play to the child's strengths. And there's so many different things that OT does and that counseling does that when you bring it together, it really forms this beautiful package. And so I think really normalizing the experiences is something that can be so empowering for the family and the individual themselves.
And one of the things that we've talked about in other episodes, which has, is this idea of trauma and what a trauma can be, and specifically children who maybe have choked on something or had a bad experience now can develop an issue with food. So how something like trauma, wherever it causes, can both lead to needing OT and needing counseling?
Yeah, that's a really good question. We actually hosted a CEU earlier this year for our OTs and our counselors because, in OT, you don't typically think of a kiddo coming to OT for a traumatic experience. You think of them going to counseling, But I think the truth in that is that traumatic experiences can kind of rewire how your system responds to different stimuli in your environment. We know that to be true. And with taking a neurophysiological approach, taking that bottom-up approach of, okay, what is your system doing when that trigger occurs? It's immediately going into fight or flight. So how are we going to either accommodate or work to kind of rewire that response a little bit for you to make it so that's not your initial go-to, or so you're able to kind of take that pause, and even if your system's giving you that shock of like, okay, that's just my system. I'm safe right now. I can ground myself and now I can move forward. That's what we're working towards.
Would you see more of this kind of prevalence of some of these sensory seeking or sort of trauma-based responses from younger kids, or more that teen tween age? Or is it really, I mean, it could be anything goes, honestly. Anything goes?
Yeah, I would say anything goes is probably, yeah. I mean, for me, like, I think I don't necessarily look at the ages of the kiddo. I look at what they're going through, where they're at in life, developmentally, emotionally, all of those pieces, because I think age is so much more than a number, as we all know. And it's more about the context of your life and where you're at in that moment. So I think it's hard to like give blanketed statements in that sense, because we do everything so individually tailored to the kiddo that we're working with.
And I think that that's something to emphasize, especially when you have a child that's in OT and counseling, or OT, PT, and ABA. So talk to me a little bit about how you individualize the treatment, and how it really at Westside, it is a one-on-one approach. Mm-hmm. There's not 30 kids in your session. It's just you and that kiddo. So kind of walk me through how you can help a parent navigate the fact that their kiddo is in multiple therapies.
Do you want to start with counseling?
Yeah, I think that definitely, and I'll try not to go on my soapbox too much.
No, you can go on your soapbox.
I'm so passionate about neuro-affirming approaches and recognizing, appreciating, and honoring the child's strengths, their abilities, and their play preferences. So I think there's so many different ways that you can incorporate that into each session. And I think honoring who they are as people is something that is so incredibly important. So if they love working with dinosaurs, we're going to incorporate that into session, because everywhere else in their world, they're going to be told, well, it's time to stop talking about dinosaurs, or it's time to do this. And that also kind of plays into what we were discussing earlier about trauma as well. A lot of neurodivergent clients experience that underlying trauma from the world responding to them in a way that is not affirming. And so that's where I think we can all come into play.
I love that.
Yeah. And then I think from OT, I mean, it's a very similar approach. Again, we're keeping that kiddo at the forefront of our mind. What are some of their strengths? What are they interested in? What do they want and need to do on a daily basis? We're getting to know you and trying to enter your world. I think it's so easy for us as adults to know exactly what we need to do to function day to day, that we forget that kids are still learning those pieces, And we live in a chaotic world where time is of the essence. And so I think sometimes that contributes to some of the frustrations that parents are feeling. Totally understandable. It's a hard world that we live in today, But I think for us, as much as we can enter that kiddo's world and gain their trust and show them that we're on their team and we're there for them, we're their support, we're their cheerleader, we're whatever you want to call us, we're here to help you, And that's, I think, what I lead with in my sessions predominantly is that, I don't know what your experience is like, and I probably never will, but man, am I going to try to enter your world, whether that's, engaging in your stims with you, or doing something that looks totally off the wall, and someone would walk in and be like, what is she doing? Like, I don't care, I'll have fun with the kid. If it means I'm connecting with them, that's of the utmost importance.
And what are their goals too? What do they want to work on? There's so much of a misconception of, okay, I'm bringing my child to therapy because there's these different problems to work on. What does the child want? What is the child's goals in life? How do they best want to, be successful in this world around them? Is it engaging with other people? Is it not engaging with other people and finding other ways to be successful? It's really looking at the individual child and what they want to do and what they want to accomplish.
I love that. I think so many times we take our kid to therapy because it's something that we find that as parents or caregivers or society, we don't like, whether it's, tapping or emotional stemming or whatever it is. So when you're talking about measurable outcomes, obviously it looks different for each child, but when you are looking at a kiddo in OT, when you look at outcomes, what are some of the outcomes that a child can experience positive outcomes in OT? And I think this is actually a two-part question now that I think of it. I think there are outcomes that the parent would want to see, but also talk to me really about the outcomes that a kiddo can see, that a kiddo can that can recognize for themselves.
Yeah. I think a big part of OT is that facilitation of functional independence and engagement in things that they want to engage in, but for whatever reason, they're having a little bit of trouble. Outcomes, like you said, can vary so much. It can be, data driven. And that's obviously, how we track our progress and things like that. But then there are also those immeasurable pieces where, you see the kid who walks in tears every single time they walk through the door. But today they walked in with a big smile on their face and they were ready to go with their therapist. Like, to somebody, a bystander, they would have no idea that that was such a huge win. I think that, when I first got into the field of OT, that was the thing that I appreciated the most about it, was that it puts so much into perspective for you. The smallest things can become the biggest wins. And so I think when you're measuring outcomes, it's important to look for those little wins, especially with some of your more complex or trickier cases where some of those bigger, more tangible wins are a little bit fewer and more far between. Those are the little wins that you can grasp onto every day to keep yourself going, because progress isn't linear. You're going to be jumping here, you're going to be jumping there. And that's just kind of how it goes. These kiddos are figuring out their worlds, figuring out how to navigate it. And that's a hard thing to do. And we're here to help them.
Yeah, absolutely. And so for counseling too, and working with OT, again, I think I love how you mentioned it. Like, what are the kids' goals?
Mm-hmm. Absolutely. I think we look at functioning and we look at what is distressing to the child and what do they want to accomplish. I joke, I use anxiety as an example, or social anxiety. And do they, present with symptoms of anxiety and they do not go to a birthday party because they are so anxious about how they are going to be perceived, but they want to connect with other people. They want to engage. And then that might be something that we work on. Like, okay, how can we limit the anxiety or bring it down to a level to where you are able to attend this party that you so badly want to attend? Versus there are some people who are never going to want to go to a major rock concert and join, a mosh pit, so to speak.
And that's okay.
Absolutely. Absolutely. So we might not necessarily work on the anxiety and, expose someone with social anxiety to that experience because that's not their goal. That's not something that they want to do. So it's really looking at what do you want to accomplish and how can we get there in a way that makes you feel best and most confident as well.
And I think that's important to kind of go back to, again, with all the therapies at Westside, it's about the individual. Just because society says you should be in a mosh pit doesn't mean we want to take you into a mosh pit. I don't want to go in a mosh pit. But it seems like there's a lot more, at least maybe talked about, stresses for anxiety, sensibilities, sensitivities, school-related stress. Are you seeing in both your practices much more anxiety-driven behavior?
Yeah, I would say for OT, for sure, we have seen in general just an increase in emotional regulation kiddos in our field. I think that was kind of a very small portion of what we saw. And I want to say like maybe even in the pre-COVID world. But I think, you guys in a previous segment talked about, some of the implications of COVID and how that's affected kiddos growing up during this time. And I think we're seeing a lot of that now, the differences in socialization patterns that these kiddos have had that they wouldn't have had in the past, I think that's led to a little bit of an increase in that for us in OT. So that, we were a little out of our element when we first started getting that. We're like, we can teach your kid to write all day long. We can do sensory processing, obstacle courses, all that stuff. But when it comes to emotional regulation, like, how do we tackle that? Are we even in our lane to be working with kiddos who have anxiety? We don't get a lot of education on that in school. A lot of the more complex emotional regulation, anxiety, depression, PTSD, all of those things, like we don't, and those are sensitive topics. We don't want to say or do the wrong thing. And we want to make sure we have the education to support. And I think that's where the partnership between OT and counseling is so beautiful, because we can get together and we can bounce ideas off of each other and figure out what's working on one end, how we can support each other and work together towards that outcome that we're looking for.
And I think, if a child, could hear this episode and to, that they have a nervous tick, or they and people often say, well, my kid's stemming, or, and like, how could you get through that child? Like, it's okay.
Absolutely. I think different is okay. Different is beautiful. And that's why I love the neuroaffirming approach and the neurodiversity movement so much, because I think it allows everyone to appreciate the differences in how our brains work, how our brains operate, and what we can do. And so I think it's helping the child understand that that might be their sensory preference, and that is 100% okay. And I loved what Allie had said earlier about how we're not going to stop the stimming behavior unless it's limiting their ability to function. Is it something that's regulating for them? Is it something that's part of who they are? That's how they work, through those really strong emotions that come into play. We're not going to stop that from happening. And so I think that's really the approach that we like to take.
I love that. So I think too, a lot of kids, I've said this before, it's like they come out of the womb and they've got an iPad stuck to their head and it just texts everywhere. So let's talk about for parents, the good, the bad, the ugly with tech. For OT specifically, are there certain tools, technology that you feel is really helpful for kids who are in OT or who might benefit from OT?
Yeah, I mean, we use a lot of assistive technology in OT. So I would say in that aspect, technology is so incredible. The opportunities that it can award to our kiddos who might have restricted range of motion or restricted abilities to communicate or to do other things throughout their day. Tech has been so freaking phenomenal for those kiddos. And I think, again, there's good and bad to most things in life. And I think tech comes with a lot of perks of things that it can offer our families. But I do also think that when used in an all-consuming way, it can be a bit of a hindrance to our kiddos' development. I advocate for it to be more of a supplement than a tool. We do use some apps in OT like that geared towards handwriting and things like that for our earlier learners who are like, I want nothing to do with this pencil and paper stuff. Like, I'm going to sit here and I'm just going to scream at you because I don't want to do it. I don't want to do it. That's not what I'm interested in. It doesn't hold my attention. But then you give it to them on an iPad and they're all for it. They'll trace those letters all day long. So if it's something that will get their initial attention and engagement to get a little bit more buy-in into an activity that we know they might not necessarily love, but is important for them to do on a daily basis, that's one of the great ways that we tend to use it.
And, for counseling, we've talked about this in earlier episodes too, how social media is not all that bad, but like with everything, it's a balance. So I would think counseling would take a similar approach of tech is a balance.
100%. There's so many great uses of technology. There's so many great apps out there that can walk you through different coping strategies, can help you track your mood and triggers to specific feelings and how you best navigate those. Wonderful and on that aspect, but also that finding that balance as well too, and making sure that it's a supplement and that we're using a multitude of different interventions and tools to best help the child and to help them grow and to learn in the best way that they can.
And I think we've talked about this too, how therapy, it's always been around, but it's much more open and accepted now. Are there, whether it's in OT or in counseling, are there certain innovations or things that you're seeing that are really opening up opportunities for kiddos in therapy, things that are happening in the world? And obviously, tech does play a big part of that.
Yeah. I mean, I think in OT specifically, the access to information has almost been twofold. You can find your community of people who you can go to for emotional support, who you can identify with, who you can problem solve with through some of those tricky situations. But it has its areas of limitation too, and its challenges.
What are some trends?
Trends. Okay.
There's lots of trends that
Yeah.
like different like DBT and like cognitive behavioral therapy, and then people get on these like trends. So I was interested to know, are there certain trends that you're seeing in OT now, maybe like post-COVID, that we might have more kids with anxiety?
Okay. Yeah, I would definitely say that's true. There have been definite upticks, and like I said earlier, those emotional regulation kiddos, we're seeing a lot more of that. I think social exposure, again, has been a big one that our kiddos have had differently than they have had in the past, and that has required some exposure to some skills that they haven't been exposed to yet, And I think too, for OT, one of the biggest things that I've been seeing is, not that it's necessarily coming from OTs or anything like that, but all of these like reels and clips that are out there that are capturing those moments happening in the homes of these families, similar to the families that we're working with on a daily basis, and normalizing all of this. Like, hey, we go through hard times too. And I think the drawback in that then is that with so much information, you never really know which direction to go. There's so much at our fingertips every single day saying this parenting strategy is effective. Oh, wait, no, research disproved that this parenting strategy is effective. That's hard to filter through all of that and find out which one is truly going to work for your kiddo. And you know what? You might use one strategy beautifully with your kiddo that works wonders one day, and then the next day it doesn't work. I think it's hard for parents to navigate that. But, you know, the biggest thing I want people to remember is like, we get a lot of these littles in. That's a precursor to counseling a lot of the times. When the kiddos aren't necessarily ready to engage in more of the talk therapy piece, they come to OT. And I think a lot of times the parents are expecting these kiddos who are 3, 4, 5 years old to be able to just problem solve and regulate, because that's what the world needs them to be doing right now. And that's what makes things a little bit easier to get by in our daily life. And who doesn't want their daily life to be a little bit easier, you know? But if you're looking at brain development and all of that, like your prefrontal cortex is not even capable of thinking abstractly until you're reaching that like 6, 7-year-old range. Kiddos are in their senses. They are focusing on what's concrete. What can I see? What can I feel? What is in my environment that is affecting me? So when you're trying to reason with a kid, it's not going to work. And I think that's one of my biggest takeaways.
I love that. And this might be kind of a broad question, but give us some examples of what does an OT session really, what does it look like? When you drop your kid off at OT, what are they doing?
I mean, we do, I would say for myself, I like to do child-led, but therapist facilitated. And what that kind of means is I like to go off what the kiddo needs that day, because just because we have all of these goals written out doesn't necessarily mean that's what they're going to need that day in treatment from me. They might have come from a really bad day in school and they're like, you know what? I don't want to sit at the table and work on my sizing and spacing of my letters for 20 minutes today. I need to talk about how my day was. And so for me, I'm going to go with what you need that day. Are we going to try to target our goals? Absolutely. But for those one-off sessions, to keep that rapport high, to keep the trust and those kiddos feeling supported and maintaining that connection, I think that takes precedence.
And I know in being able to work at Westside and see the incredible, what we call the OT gym.
Yeah.
For those parents that aren't familiar, I mean, tell us about the OT gym. I mean, and again, that comes down to, wait, don't you play at a gym?
Oh, it is the place to be. I would, it looks so fun and it looks so inviting. And I personally take a big interest in safety. And I think that's one of the biggest pieces that we have to clarify with families when they first come in is this looks like a super fun playground, but this is still a therapeutic space. Everything that we have in here was put in here with intention because we can use it for so many different aspects of our treatment with kiddos. You know, with being that jack of all trades discipline, we're focusing on sensory processing. We're focusing on executive functioning, motor skills, regulation, all of these 5 million pieces that like you wouldn't even necessarily see if you were just sitting there watching a session. But everything we do has so much intent, and we are so creative and good at kind of wiggling those things in a way that don't feel like a huge demand to the kids.
Well, and it comes back to this what does play-based approach mean?
I mean, you're taking the interest of the kiddo and you're making it work for them. That play-based approach, a kid's occupation, if you think about it, is play. That's their world. That's how they're learning. That's how they're navigating. And so the more we can facilitate play for kids, and play isn't even necessarily that, traditional sense of what play means. Play can mean different things for different kids. Like McKenna was saying earlier, our neurodivergent kiddos, their play might look differently than a neurotypical kiddo who we're working with. And that's okay. That goes back to what I was saying earlier of I'm going to enter your world. I'm going to play how you want to play because I don't feel like a lot of people do that for you.
Yeah. And so for that kind of play-based approach, how does that work in a counseling session where you want talk, but also like we talked about another episode with littles, they can't really lay down and on a couch and let me tell you about my day. Like, so how do you incorporate play in your world?
Absolutely. There's so many ways that you can incorporate that. And I love what Allie had said about child-led experiences and therapist-facilitated experiences, because There's so much that you can incorporate. Play itself naturally is healing. Play itself is therapeutic, and it is a learning experience for all. That is, so entering the child's world and incorporating things like art techniques, allowing them to see what happens when they put pen to paper, is really, you can learn so much about the child and what they're drawing about and what's important to them, or even different games that we play, how they respond to different therapeutic prompts. How they play and what they do. It definitely reflects what they're learning in their outside world, outside of session. And you can play off of that, and you can really learn so much about a child based on what they're doing right in front of you.
When we talked about this again, like learning about the kid and understanding what an outcome is, and I know we've talked in other episodes about, maybe in emotional regulation, it's instead of I'm breaking a pen instead of smashing my fist against a wall for but what are some of those outcomes, sort of more tangible outcomes in OT that you might see for a child?
Yeah. Similarly to counseling, we're looking to, see decreases in the intensity, the frequency, the duration of when these episodes are occurring with these kiddos. But it's going to look different for every family. I think everybody has different wants and needs for what their day needs to look like, just to get by. And so I think, what one family might be wanting out of their kiddo could be a little bit different from what another family is. But I think it, again, goes back to some of those little wins. And that's what I like to point out to parents is, hey, we might not have gotten that big overarching 50% decrease in the tantrum behaviors that we wrote the goal for. But you know what? When you went to that party last weekend, your kiddo got overwhelmed and came up to you and said, Mom, I need to take a break instead of throwing a tantrum. And I think that in itself is a huge win. Take those good, positive moments, reinforce those, focus on the good, because our kiddos need that. Our kiddos are constantly hearing the things they need to work on. So let's build them up and be proud of those moments where they are doing well and doing the things that we're asking of them.
I think one of the greatest things about Westside is we don't just treat the child, we're treating the whole family. We have these parent caregiver sessions. So we've talked in other episodes about how that looks in counseling. How does a parent caregiver training session look in OT?
That's a great question. Last year, CPT actually released a new code for OT, speech, and physical therapy to be able to bill for caregiver education sessions. That's been, obviously, as a newer thing, a little bit tricky to navigate for us, and we're still kind of working through all the insurance pieces that go along with that. But for the families who have had access to that, I think that has been crucial. The way OT is structured is that we do 60-minute sessions, and we do the 5 minutes at the beginning to kind of do the debrief with the parents. Then we get about 5 minutes at the end to talk about how the session went and any carryover. Anyone who's been in a Westside waiting room knows that it can get loud, it can get chaotic. There's so many conversations happening at once. You're trying to watch your kid and potentially their siblings who you've brought with. Well, there's 5 million other kids running around at the same time. That's not the best time to deliver this information to parents. And I think that's what's hard. As therapists, we know how important carryover is. We see them for 1 hour, maybe 2 a week. That's a drop in their bucket. They're exposed to so much more on a regular basis. So if we're not seeing the carryover with parents, that's where it gets hard. Those caregiver training sessions, when they've worked out, have been phenomenal for that, giving us the opportunity to sit down, thoroughly explain why we're giving the suggestions that we're giving, and working with the family to see what's feasible for them. Because we can throw out suggestions all day long to families, but if you don't have the capacity to implement a sensory diet 5 times a day for 20 minutes at a time, that's not going to work. We need to meet you where you're at so that you can commit to what we're asking you to commit to.
Well, I think it comes down to the family-focused collaborative approach.
Yes.
For sure. What are some, whether it's like websites, tools, things, we've talked about this in other episodes, just things that are out there that, whether it's books or, what comes to my mind is the Spot book we talked about in another episode. What are some things especially for a kiddo that is in treatment in OT and counseling? What are some good, resources for kids to go to that make sense to help support that therapeutic journey?
I think I go back to, and I don't know how much of a resource this would necessarily be for young children, but a lot for families and for caregivers. The Child Mind Institute has a lot of great resources, informational tools, and things that can really help enter the child's world. That's one that I often recommend. And I think also there's a book called The Explosive Child, and it really talks about ways to connect with your child, co-regulate, and also get their opinion on what can work and what might be helpful for them, identifying the problem and then looking at solutions together, really hearing them out in the process. So that's one that I often refer to parents as well for counseling.
And just to tag on to that for OT, my end-all be-all recommendation for books for parents is Raising Kids with Big Baffling Behaviors by Robin Gobble. This book is the essence of how we treat emotional regulation in OT, and it takes that neurophysiological approach. So that bottom up, our sensory systems, how is sensory impacting us? How is our neurological system shaping how we're doing throughout our day, but also making it reader friendly so that it's not filled with all this technical jargon that parents can't understand. It puts it in a very practical sense that is outcome driven, that gives all of these different strategies and helps you to just understand a little bit better as to what your kiddo is going through and how you can support them.
I love that.
Yeah.
And, I always go back to Inside Out.
Yeah.
1 and 2.
Great.
1 and 2. And for as an adult who, is around lots of kids and all emotions are okay, but it's just the behaviors we have to work on. All emotions are okay. And you can do things that, whether it's to tap your foot or to make you feel better, but does it take away the function? So, I guess to close, what are some takeaways for parents and one takeaway for a parent and one takeaway for a kid about OT and counseling that you would want them to know? If you can narrow it down, I know there's a lot.
I think it's one thing that comes to mind, even as we were, having this conversation today, is it's not the absence of problems. There's always going to be life problems. There's always going to be things that come our way that make us feel so many different ways. It's what we do with them that is what's most important, and that's how we can help, and that's how we can intervene. It's a lot of times what I tell the children that I see, especially with depression, like there's going to be sadness, there's going to be bad things that happen, and it's what we do with them and how we recover from that and how we really just become resilient in those moments. So I think that's kind of a key takeaway, I would say, for both children and for parents. I think for children, I go back to different is okay, and how your brain works is 100% okay. Your play preferences, what you like to do, your strengths are yours, and no one can take that from you. And that's such a beautiful, beautiful thing. And for parents, kind of echoing that sentiment, that celebrate who your child is as a person. We're not trying to change your child and who they are, because who they are is already perfect. And so really helping them, to support their child in those ways would be a big takeaway that I would want for parents to have.
I love that.
It's amazing. And I mean, I'm going to echo pretty much everything that McKenna said. I think that was spot on for both of our disciplines. I mean, my biggest, takeaway for OT is going to be connection. You can build anything off of trust and connection and safety. So facilitating that ground level structure of I'm here for you to support you. I know that things aren't always going to go right, but we're here to work through it together. Like I said, we live in a very fast-paced, challenging world, and I think sometimes that world expects a lot of these kiddos that they're not necessarily ready for. So keeping that in the back of your mind of just because the world's saying they need to be doing this doesn't mean that's necessarily true. Kiddos are on their own timelines. They're working through things on their own. They're trying to navigate this complex world in the best ways that they can. Facilitate that connection.
I love it. It's all about the connection, and that's why we are in session. Thank you for joining us. We will see you next time on the couch in session.